Hi everyone! For this anatomical model video, I will go over some of the vertebral bones of the spine. So we'll start with these three vertebral bone right here, which this one is cervical vertebral bone. This one is thoracic vertebrae. This one is lumbar vertebrae. How can you tell the difference between these three? The easiest way to tell is, of course, its size. Cervical vertebrate bones tend to be smaller because of the fact that they make up your neck. All of your entire neck region is made up of cervical vertebrate bones. And the other thing you can tell is that you can look at the side view of the bone and look at this spinous process, okay? This spinous process for cervical vertebrae tends to be flatter when you're looking at it sideways. When you look at thoracic vertebrae, that spinous process right here is a lot steeper angle, dangling or angling downwards when you look at it sideways like this. Lumbar, you can see how thick it is. Like the body is very thick and it's just more chunky when you look at the differences between all three of these vertebral bones. And it is also the largest, okay? Regardless whether you have cervical, thoracic, or lumbar, you still have common features between three of these vertebral bones. First being these bone markings. You have spinous process right here for the cervical vertebrae. For the thoracic vertebrae, this is the spinous process. For the lumbar vertebrae, this is the spinous process. The chunky parts that makes up your spine is then the body right here, and the body right there. And this big hole that looks like a little triangular shape is for your spinal cord to go through down your entire spinal column. That is called the vertebral foramen. Okay, so again, inside this hole is called the vertebral foramen. For thoracic vertebrae, you have the vertebral foramen still. And then for the lumbar vertebrae, you have the vertebral foramen right there still. And for the sides, you have these two things sticking up, this one and this one. Okay, these are your transverse process, this transverse process of the cervical vertebrate bone. And then you have the thoracic, where then this and this, to me, they kind of look like little elephant ears. And this is like the elephant trunk. So then these on the side are the transverse process of the thoracic vertebrae. And then for the lumbar vertebrae, you have these two. This one is kind of broken on the side, a little bit broken. But you can see this as the transverse process, and this also is the transverse process sticking out on the side. Transverse means horizontal, so to the side. And that's it for bone marking of the vertebral bones. Now, there's two very special vertebral bone, which is the first vertebrate and the second vertebrate bones. You have this as your second one, this as your first. How can I tell? It's because of this thing sticking out, okay? So the one with this little process sticking up, which is called the dens, is actually the axis, okay? Axis with an X, okay? Axis with an X. And this one that fits very well right on top of that like that, that is the atlas with a T, okay? How you can remember which one comes first by words is that atlas with the T is alphabetically before axis with an X, okay? So atlas comes first before axis, okay? Atlas also goes right on top of axis, just like this, to form a joint where it allows your head to rotate like that, okay? So that's why there's this little indentation for the dens to fit right in there, and you can rotate your head based on this little joint, okay, that we'll talk about in the joint video. All right, so for the atlas and the axis, there's also bone marking. These little flat areas right here is called the superior articular facets, which then, for in this case, this is where those occipital condyles from the bottom of the skull, if you remember from the bottom of the skull, it is down here. and you see this is the curvature right here. This is the fake skull, fake bone skull. But you can see this occipital condyle. It actually fits perfectly with the atlas, just like that. Okay, so that's why you have that indent for what's called the superior articular facets. Okay, and then you have the transverse foramen, which is these holes. Remember, foramen means holes. So that's this hole right here and this hole right there. Both are called transverse foramen for your vertebral artery to go through. These sticking up on this side and this side is the transverse process of the atlas. As for the axis, you have the thing sticking up like this, which is the dens that kind of serve as the axle for the atlas to kind of rotate about. And you still have the superior articular facet for the atlas to sit very nicely on top like that. And then you have the spinous process still in the front of the axis. So that's it for the vertebral bones. I want to show you one more bone, which is this particular bone right here called the sacrum bone. Marks the end of your spinal, part on the back of your spine. And this is kind of, damaged throughout the years, but it is what forms this sacrum bone on the whole skeleton. And this part is called the sacrum. This little part at the bottom, which forms your tailbone, is then the coccyx. Coccyx and sacrum. And the bone by itself looks kind of like a little triangle, okay? And fits right around your rear end area. Okay? And that's it for the spine.